Hello dear students. So we can start the session and starting with pharmacology. So the very first question goes like this, like after which phase of clinical trial a new drug is introduced into the market. We know that there are 4 phases of a clinical trial. So after which phase the drug is introduced into the market? So the answer is phase 3. Now let us discuss the phases as such. Now phase 1. Now what is phase 1? Phase 1 is about the human safety. So whatever the drug we are planning to introduce into the market, it should be safer. Right? So it's about human safety. In phase 2, once we are very sure that the drug which is under consideration is safer for the humans, then we move on to phase 2, and here we try to evaluate the drug in terms of efficacy, potency, and all other drug related studies. So everything related to the drug, so that we can have the best and optimum effect, that is studied in phase 2. Now in phase 3, yes, efficacy, right Shubham? In phase 3, the drug which is under consideration, we will do therapeutic comparison, right? So we will do comparison. It means, yes, compare. So whatever the drug we are planning to introduce in the market, we have to compare that particular drug with the already available options in the market. So that is therapeutic comparison, and we just want to make sure that whatever the drug we are planning to introduce into the market, it has to be superior to the already available option. So in phase 3, we will go for comparison. And once we are sure that whatever the drug we use, it is better than the already available option in the market, we will release the drug into the market. The drug is released, introduced, clear? Now phase 4 is post marketing surveillance. Once the drug is in the market, we will have tie-up with the physicians who will prescribe this drug to their patients, and then we will study the long-term side effects, or we will study the drug interactions with other drugs. If this particular drug is given with some other drug simultaneously, what kind of interaction will come out, that is studied in, right? So in phase 3, we introduce, after the completion of the phase, we will introduce the drug into the, right? So phase 1, phase 2, phase 4, and phase 4 is a very long-term study. The doctors will prescribe the drug to the patients, and then we will gather up the data about the drug side effects and all. Right? So the better answer is phase. Yeah. So phase 1 is about drug safety, and of course here we try the drug on, right? We will give the drug to normal, you can say healthy volunteers, and this is given under, you can say, ICU setup, because we don't know what kind of effects might come. So we should have all those facilities readily available in case if there is some life-threatening side effect. So phase 1 is about checking the drug safety, and that is the trial on normal humans. Once this is done, we'll go to the phase 2, which is done on small segment of patient, and we do all drug related studies like in what dose, frequency the drug will be more beneficial. Right? And in phase 3, we will compare it with the already available in the market. And once we are confirmed that yes, this will be definitely a better option for condition for being markulated. So after that, we can release it into the market. And phase 4 is long-term studies. Yes, one is saying like COVID vaccine. So that is long-term study. So introduction of phase. Yeah. Now, high volume of distribution of a drug depends on the lipid solubility. So more lipid soluble the drug, more is the volume of distribution. Right? So that depends on lipid solubility. Now, what adverse effect of lithium can be on long-term administration, except, so not a feature of or not a side effect of lithium therapy after 1 year? The answer is yes, Rubik, you are right. The answer is tardive dyskinesia. We see tremors, we see even diabetes insipidus. So tardive dyskinesia has nothing to do with lithium therapy. Now, which of the following drug shows zero order kinetics? Now, before that, we should understand what is zero order kinetics, first order kinetics. In zero order kinetics, there is excretion of the drug, but there is a fixed amount drug is, so there is a fixed amount of drug is excreted, and suppose if you are given 100 mg of drug, and if it 25 milligram is excreted, so every time 25 milligram will be excreted. So 75 and again 25, right? So this is constant amount is excreted. Clear? So this is zero order kinetics. Then the other pattern is the first order kinetics. Another one is the first order kinetics. Here a constant fraction is excreted. Here a constant fraction, it can be say 20% or 30%, whatever. So a constant fraction will be excreted in first order kinetics, and a constant value or constant amount will be excreted in zero order kinetics. So this is the basic difference between the two. And if you look at the curve, so for zero order kinetics, it is a straight line. For zero order, it is a straight line, and for first order, it is a curved line. This first, this is here. So in zero order, there is a constant amount which is excreted. In first order, there is a constant fraction or a constant proportion of the drug eliminated per unit of time. So zero order is shown by phenytoin. Yes, you can have your own mnemonics, no problem, but that is the basic concept. Amount zero order and in clear. Now which of the following drug requires therapeutic drug monitoring? It means the optimum effect exerted within a specific plasma range, right? If the value is below that range, optimal effect, and if the value is above that range, there will be toxicity, you can say. So the optimum value will produce optimum results, and therefore we have to monitor that the drug concentration in the plasma is within that particular range. So for that we need to measure the amount of drug in the blood, and that is known as therapeutic drug monitoring. Now this is seen in cases of phenytoin, but you should remember at least two examples. One is lithium, of course, and second is hydroxy. Please remember at least two examples, lithium and hydroxy. We have to check their plasma values. So this is the concept of therapeutic drug monitoring. The alcoholic male patient, he is taking metronidazole and now developed flushing episode. What is this? Very good. So this is disulfiram reaction. Now, what actually is this drug disulfiram? Any idea what disulfiram? Now, this disulfiram is given for de-addiction of alcoholism. Right? So, de-addiction of alcoholism, and if patient is taking disulfiram and if we consume alcohol also at the same time, there will be severe reaction in the form of flushing. So if the person is on disulfiram, he will avoid taking alcohol because of these reactions, which is actually known as the disulfiram reaction. So sometimes same kind of effect can be shown by some other drug as well, like metronidazole. So this is actually the disulfiram. To answer this question, you have to understand that one of the major side effect of ACE inhibitors is hyper. Right? So it is a side effect of ACE inhibitors. So there is no point in giving ACE inhibitors in a patient who is already having hyperkalemia. Right? Otherwise, this will lead to fatal hyperkalemia. And based on the same concept, it is also said that never combine ACE inhibitor with any other drug which is also causing hyperkalemia. Because if you give these kind of drug which is causing hyperkalemia, there will be fatal hyper. And one of the classical example is spironolactone. Never give ACE inhibitor with spironolactone, because spironolactone is also a potassium sparing diuretic. So there will be fatal hyperkalemia. So please remember, one of the complication of ACE inhibitor is hyperkalemia. There is no point in giving ACE inhibitor to a patient with hyperkalemia. This is a good question. Which of the following is valuable in obtaining variation in sensitivity of response to different doses of drug in different? Yes, this is dose response curve. Yes, DRC, very good. Dose response curve. And if you look at the dose response curve, you will find two terms. One is the potency. One term is potency, and another term is efficacy. There are two terms which we discuss in dose curve. One is potency and another is efficacy. Now, potency is the amount of drug required to produce certain response. Okay. So, it is the amount of drug which is required to produce certain desired response. Suppose if you see in the graph, if you compare the drug A and B and the A and C, sorry, it's better to compare A and C. So compare, this is the desired response. Suppose this is the response we want to expect, we are expecting. So this much amount of drug A is required to give the response, whereas you need a little more amount of drug of C to get this response. So it means A is more potent than C, because the amount of response which is achieved by C, the same amount can be achieved by A in a very less quantity of drug, right? So the amount of drug required to produce certain response, that is known as potency. And in this case, you can say that A is more potent drug C. Clear? So whatever amount of drug for a particular effect, that will decide whether it is potent, more potent or less potent. Now another term is efficacy. Efficacy means the maximal response a drug will produce in a given, right? So if you are giving same dose and then you will look at the height of the curve, so that is known as efficacy. Yeah. So maximum response, efficacy, and amount of drug or the dose of drug get that particular response is potent. Please remember this concept, because many times we have a graph based question and the question revolves around these 2 points only: which drug is more potent, efficacious. So that is the concept. Clear? And here we don't have actually anything related to efficacy, but if I can draw, I draw a drug, say this is drug C, then drug D, then you can say drug C is more efficacious than drug. Okay. So this is how we describe potency. Clear? Now B cannot be taken here because B is not going up to the desired response. So better comparison can, in terms of potency, can be done between A and. So for potency, the higher part has to be same, and for efficacy, the lower part, the lower point or the concentration of the drug has to be. Yeah. Chalo, next question. A patient has pain related to gout and this pain subsided. Now we want to excrete, we want to promote the excretion of uric acid. Which drug? Yes, you are absolutely right. This is probenecid. So this is uric drug, means it will promote excretion of uric. Fine. So this is probenecid. Remember, allopurinol prevents formation of uric by inhibiting oxidation. Okay? uricosuric, right? Which of the following diuretic inhibits carbonic anhydrase enzyme? Acetazolamide, yes, correct. Acetazolamide. And if you have just a basic classification of the diuretics, the one which you should know at least, one is the osmotic diuretic, which is mannitol. The second one, the carbonic anhydrase inhibitor, that is acetazolamide. The third one, or most important one, in fact, these are the loop diuretics, high ceiling diuretics, especially furosemide. Fourth one is the thiazide group, includes hydrochlorothiazide. And potassium sparing is spironolactone, which opposes the. Next question. A known case of hypertension was on some antihypertensive drug, but during the course of the treatment, he developed cough. Which drug can? I think this is a very basic question. So this is dry cough, very common side effect of ACE inhibitor. Yeah, dry cough. Everyone is right. Now, patient of schizophrenia is responding well to haloperidol, but later on he developed symptoms of Parkinsonism, that is antipsychotic extrapyramidal side effects because of antipsychotics. Now, which drug should be given to control this complication? Very good, Raghu. Especially in cases of drug induced Parkinsonism, you have to give anticholinergic, that is benchtropine or benhexo. Very good. Perfect. Next question. Patient has morning stiffness, joints, and the treating doctor planned to start the disease modifying agents in rheumatic disease. Which one requires fundus examination and regular monitoring of visual acuity if started? Yes, this is hydroxychloroquine, right? Hydroxychloroquine. It can cause bull's eye maculopathy. Yeah. So with the Pratusha, you are right. So this is bull's eye maculopathy for hydroxychloroquine, and the possibility is even more with chloroquine as compared to hydroxychloroquine. So fundus examination, visual acuity has to be monitored while we are giving hydroxy. Now, which of the following anti-asthmatic drug does not cause bronchodilation? Which of the following anti-asthmatic does not cause bronchodilation? And what is the answer? Yes, hydrocortisone, because this is steroid and these are anti-inflammatory. Has to do nothing with bronchodilation. So steroid. And if you take the classification for the bronchodilators, you can have anticholinergic, of course, principally pratropium or tiotropium. Then you can have sympathomimetics like salbutamol, terbutaline, okay, and then you can have methylxanthine, namely theophylline. Or post-COVID, patient develops tingling sensation, and as per him, that he took this of medicine during pyridoxine. Yeah, that can lead to Raghu, absolutely right. So this is tingling sensation because of excess of pyridoxine. Next question. A pregnant lady with Vivax malaria, which drug is preferred in this case? What can be given? Yes, very good. Quinine can be given into a pregnant lady with Vivax malaria. Yes, right. Now, mechanism of action of furosemide. is high ceiling or loop diuretics. Yes, and these are also known as loop diuretics because they act in loop of Henle, where they inhibit the enzyme, the symporter, sodium potassium chloride symporter in the loop of Henle. So this is the site of action of loop diuretics, where they inhibit sodium potassium chloride transport. Izides, they act at the distal converted tubule, where they inhibit the sodium chloride transporter. Then the potassium spiruline diuretics, they act on the DCT and they inhibit the action of aldosterone. These are the three important class of diuretics and their site of action. So furosemide, also known as loop diuretics because they act at the loop of Henle. Now, a patient presented with resting tremor, rigidity and bradykinesia. Which of the drug will not be helpful in managing this case? Yes, so the classical this presentation is, and it acts by inhibiting which enzyme? Acetylcholinase enzyme, and this is the enzyme which actually degrades. So in one way it is, yes, donepezil galantamine can also be used for Alzheimer's. So this makes sure that whatever the functioning neurons are there, at least the acetylcholine which is secreted is preserved. It is not destroyed by acetylcholine. Right? So rivastigmine has nothing to do with Parkinson disease. Now imipenem is co-administered with cilastatin. Why? Why imipenem is given with cilastatin and not alone? Actually, what happens? Imipenem destroyed by dehydrogenase. So the degradation is done by dehydropeptidase. So what we want to do, we want to give a drug which will inhibit this enzyme. For that we give cilastatin. Right? So cilastatin will inhibit dehydropeptides and will make sure that imipenem is there in the sufficient quantity so as to bring about the pharmacological effects. Right? So that's why instead of plain imipenem, we prefer imipenem plus in combination. Very good. That is the reason why we add cilastatin to imipenem. The answer is cilastatin inhibits an enzyme in the kidney which degrades imipenem. Here, next question. A newborn is born with cleft lip, cleft palate is important here, ASD, and there is history of some drug intake by mother. What drug it can be? Yes, you are right, absolutely right. It is isotretinoin, and here the classical is cleft palate, classical. Apart from this, there can be thymic aplasia. Also, there can be neural tube. Cleft palate is classical for as a teratogenic effect of isotretinoin. Therefore, whenever we are using isotretinoin in nodulocystic acne, always rule out pregnancy. So always rule out pregnancy. Very important. Which drug is least effective in a male patient who is having burning micturition and there is large number of pus cells on urinary examination. Anyone? What is the clinical condition? What is the clinical condition? Clinical condition is UTI. Right? So this is urinary tract infection and there is dysuria and we can see large number of pulse cells. So here the treatment actually is urinary antiseptics here, and moxifloxacin is not a member of this category. Right? So we can give nitrofurantoin, nalidixic acid, ciprofloxacin. So urinary antiseptics has to be given. For bipolar disorder, what needs to be given? For bipolar disorder, this is lithium for bipolar. The drug of yes, we can use lithium with antipsychotics, but theoretically, if there is a question, you have to mark lithium. Need to give antipsychotics in combination as well. A patient was on anti-cancer chemotherapy, but later on he developed fever, sore throat, and presentation suggestive of severe infection. And when we did TLC, we found that TLC was only 2000 meter. So what drug can be given now? Yes, this is filgrastim. So you can see this is all of neutropenia. Your infection, this is of neutropenia. Boy had generalized tonic-clonic seizures for 8 minutes. Airway is okay, but the child is continuing to have seizure. What should be the initial step to control seizures? Here, if child is having continued seizure activity, some book says that even like for more than 5 minutes, it can be presumed as status epilepticus. Right? Considering this case as a case of status epilepticus, we should go for lorazepam, diazepam, whatever is available. Right? So we have to terminate the seizure attack. Right? So this can be taken as a case of status epilepticus to go for diazepam or lorazepam. Now, a young traveler who visits rural spaces had taken something unhygienic and he developed abdomen pain with watery stools. So what should be given? Next question. Professor was teaching students about side effects of a drug which is gynecomastia in males or menstrual irregularity in females. Which drug she is talking about? This is, of course, here everyone is right. This is spironolactone, which is a potassium diuretic, acts by antagonizing effects of aldosterone. Early part of collecting duct. And if come to the side effect, just remember two important side effects. One is, of course, this question is gynecomastia in. Second is, since it is a potassium sparing diuretic, it can cause hyper. Next question. Which antidepressant which acts by inhibiting reuptake of both serotonin and noradrenaline? Yes, this is, we are talking about SNRI drug is selective norepinephrine and noradrenaline reuptake inhibitor. This is venlafaxine. Serotonin norepinephrine reuptake inhibitor. This is venlafaxine. Now, the next question. A person is showing resistance to isoniazid, rifampicin, kanamycin and ciprofloxacin. This will be labeled as extensive drug resistance. That is R. And how we define XDR? We have to, there is resistance to isoniazid plus rifampicin, then any fluoroquinolone. In the given question it is oxygen, and any second line injectable. And in this question, clear? So this is XDR. I think most of you must be remembering there is only isoniazid plus rifampicin. We will call it here. That's simple, MDR. So this is XDR TB. Now next question. Patient has shooting pain on touching the face, on chewing or speaking or brushing the teeth. Yes, everyone is right, carbamazepine. But what is the condition? Clinical condition? Trigeminal. There is very sharp shooting pain in the district trigeminal nerve, and we know that trigeminal nerve provides sensory supply to the entire face through its three branches. Typical case of trigeminal neuralgia for which we can give carbamazepine. Next question. A patient was given primaquine, but he developed dark colored urine. What could be the reason behind this? Yes, this is glucose 6-phosphate dehydrogenase deficiency, and we know that there is one concept like hemolysis D6PD deficient. That is this concept, and there are certain drugs like Capson, primaquine. The person is, yes, flavavine, yes, the list is very long. So we have to be very cautious while using these drugs in a person who is a known case of D6PD deficient. Yeah? Person is planning to travel to malaria endemic area. What is this flumazenil? What is flumazenil? Flumazenil is antidote for benzodiazepine overdose. It has nothing to do with alcoholism. Flumazenil has to answer here. That's all we can give. Next question. A known case of epilepsy was started on lamotrigine, but and the drug was 50 milligram once a day, and this is increased every 2 weeks, and finally the desired dose of 200 milligram per day was achieved. Now this kind of step titration, why it is being done for lamotrigine? Why we couldn't give the desired dose starting from the day 1? Any idea? Yes, it is very important to make sure that the whole desired drug of the lamotrigine is not started at once. It is gradually increased over a period of time till the desired dose. So this is very important. If you give the entire dose from the day 1, that can lead to the development of skin rash. Very good. This is very important. The dose has to be gradually increased till the desired dose for lamotrigine. Then again, a patient who had traveled developed chills and rigors, and there is banana-shaped gametocytes, peripheral blood smear, there is altered sensorium, and yes, this clinical picture is of very good. So this is falciparum area, and it should be managed by intravenous artisan. Right. So this is falciparum malaria, and of course you can see a little banana shaped hematocyte. A female patient has profuse dirty white discharge. Swift test is positive, and flu cells were also seen. Which drug will work? This is metronidazole, and I think most of you must be able to make the clinical diagnosis of bacterial vagina. This is a typical presentation of bacterial vaginosis where there is white discharge, positive Swift test, that is minor odor, and clue cells where the vaginal epithelial cells covered by the bacterium and they lose their definite. So this is bacterial vaginosis. Known case of chronic asthma is on theophylline, and concomitant use of which antibiotic will demand reduction in the dose of theophylline. Yes, Pratusha is much more than 5 because there is decrease in the number of lactobacillus. Now, if a person is on theophylline, which of the following antibiotic? Perfect, everyone is right. This is erythromycin, because erythromycin will inhibit or will reduce metabolism of theophylline. So if you don't decrease the drug, it can result in toxicity. Okay? So you have to reduce the amount of theophylline if you are concurrently giving erythromycin. This is the reason why we need to address. So it will inhibit the metabolism of theophylline, and that will increase the levels of theophylline in the body. So we have to reduce down the amount of. Patient with amoebiasis was given some drug, and then in a party he took alcohol. After that he developed all those flushing, nausea, vomiting. So which drug the patient was actually taking? Yes, the clinical presentation is disulfiram kind of reaction, and the person was on metronidazole. He is on metronidazole for amoebiasis. Next question, again very basic question and repeated so many number of times. A non-vegetarian has developed, I think we have already discussed one session. So first, metatarsophalangeal joint affection, similar episodes. This is a typical case of gout for which we need to, it's a typical case of chronic gout for which we need to give allopurinol, which will inhibit xanthine. Next question, basic question, is on platinum based chemotherapy, maybe platinum, and developed nausea and vomiting. So what drug can be given? Yes, this is alinosetron, that is member of ondansetron. Chemotherapy induced nausea, vomiting. A lady was on warfarin for prosthetic heart valve, and during the course of treatment she became pregnant. Now what needs to be done regarding warfarin therapy? Yes, warfarin, it's better we replace it with heparin in a pregnant lady. So better replace warfarin with heparin comparatively. Ladies has a history of previous delivery, Down syndrome. Now she has been started on lithium therapy for bipolar disorder. And what problem can occur? Yes, this is Epstein anomaly. if a pregnant lady is taking lithium, so there is possibility of abstain anomaly. Please remember, especially for a a person is planning to go to Ladakh, drug he should take to prevent the possibility of is actually high altitude cerebral edema. What? Yes, it's important, acetazolamide. So, and it has to be started for reaching high altitude. Once you reach there, then you start, it won't make any difference. It has to be started before reaching high altitude. It has to be started before. Yes, motion sickness is different from mountain sickness. And especially we are more concerned with this particular serious complication, that is high altitude cerebral edema.